Today we will discuss the topic crybabies. There are three different types of crying. There is the specific crying, then there is the unspecific crying, and there is the pathological crying. Now let's look at the specific crying. Crying in infants and toddlers is physiologically normal, as the child communicates before it can speak. This establishes the attachment behavior to the caregivers when it wants to communicate something. This can be a common thing or something that is necessary for survival, and through this one can find the cause to solve the problem. For example, temperature can play a role. For this, the relationship between clothing and room temperature must be taken into account. Approximately, the room should be 18 until 20 degrees Celsius. If the room temperature is not properly regulated, children may cry. Then we have the non-specific crying. By non-specific crying is meant the crying which is not need-oriented. If this component is not considered, then one can often hear in this case that it will grow out. And one should have patience, which can be fatal, because one no longer looks at the cause. For example, mechanical factors such as an accident can also promote excessive crying in different ways. If a child has experienced a fall, the body can be upset and the child will express itself by making noise. One-sided tension can also disturb a child to the point of making noise. By pathological crying is a crying understood which is based on a pathology. Here one must distinguish between endogenous and extraneous causes. An example for an endogenous factor is the pathological digestive system. An example for an extraneous factor is violence.